So good afternoon. Today we're going to be outlining the work we've been doing across the Commonwealth to keep people in Massachusetts safe and informed as we head further into the fall and winter months. Over the past few weeks, we started to see an increase in the number of COVID cases here, across the country, and in many other countries. For months, public health experts have forecasted this increase. We are going to be living with COVID until there is a vaccine or a treatment. But the Commonwealth's response to this pandemic has been transformational since last spring in nearly every aspect of our daily lives. In March and April, the medical community was still learning nearly everything about the virus. Public health experts everywhere were scrambling to understand transmission, infection rates, and to develop a medical response for testing and treatment. At the same time, states were left to coordinate strategies, often without much assistance from the federal government. Here in Massachusetts, we had serious limits on personal protective equipment and were left to fight it out with a broken global supply chain. There was essentially zero testing infrastructure available, and it was hard to quickly diagnose this new strain of coronavirus. In the absence of a public health and medical infrastructure that was prepared to deal with all of these issues, states were forced to close non-essential businesses and schools and encourage people to stay home. I've said many times that the spring felt like one long day, and that's because we were working around the clock to respond to the changing facts on the ground. We moved quickly to set up the COVID Command Center in March to coordinate our response, and our cabinet coordinated with stakeholders, speaking regularly with groups like hospital CEOs, local officials, education and business leaders, and long-term care providers. And through all of this, the people of Massachusetts showed incredible resilience and discipline. Your actions in those early days had a huge impact on slowing the virus and keeping people safe. And as we stand here in mid-October, we've been fighting COVID now for 9 months. And together, we've made tremendous progress to build a massive infrastructure to respond to this pandemic. And this progress puts us in a strong position to be prepared for whatever comes next. We're home to some of the brightest minds in healthcare and research. We've put our best people, in many cases, in charge of creating and advancing some of the nation's leading programs and resources to fight COVID-19. And we also set rules to keep residents safe as we reopened nearly all parts of our economy. For example, Massachusetts is now number 1 or number 2 in COVID tests performed per capita in the U.S. We were the first state in the nation to build out a contact tracing program. We were one of the first states to issue a statewide order for face coverings back in May. We provide on a daily and weekly basis a robust set of data and statistics to the public to track infection rates with a breakdown by community and for settings like nursing homes, child care providers, colleges and universities, and public schools. We deploy teams to high-risk communities to promote public health awareness and to step up enforcement. We maintain strict guidance for all businesses to safely reopen and have approached this in a more cautious way than many other states. We've issued hundreds of pages of guidance endorsed by the Massachusetts chapter of the American Academy of Pediatrics to safely get kids back to school to learn in a classroom. The Commonwealth has also built an army of experts to advise and fight COVID with us. And we'll bring every resource to bear in this battle to keep our residents safe and our communities intact. But there is no doubt that this virus will continue to challenge us. We've been working to get ahead of the obstacles that have been thrown in our way since last spring, and will continue to do so going forward, and as a result, we are better positioned to respond and protect Massachusetts. Last spring, we worked closely with leaders from the Commonwealth's world-renowned healthcare system to make sure our hospitals were ready for increased cases. This planning paid off. In many places across the globe, healthcare and hospital systems were overwhelmed. Not here in Massachusetts. In April, the number of COVID patients being treated in the ICU reached a maximum of 1,085. Today, there are around 80 patients in ICUs, a 90% reduction. Last spring, we saw a peak of about 4,000 patients being treated in our hospitals for COVID. Today, we have about 500 patients in our hospitals who have either tested positive for COVID or are suspected of testing positive, but the actual COVID patient census across Massachusetts hospitals these days is less than 300. That also represents a reduction of more than 90% from last spring's peak. When we reopened hospitals and ambulatory healthcare service providers, hospital systems had to attest to meeting strict capacity guidelines to make sure they were always prepared for new cases. Today, hospital occupancy statewide stands at 68%, and ICU occupancy stands at 52%. Hospitals deployed surge plans in the spring and have spent the past months refining those. The Commonwealth is now in a position to quickly expand capacity to care for more COVID patients if hospitalizations dramatically rise. If needed, at least an additional 450 ICU beds could be made available by converting existing med-surg space. In the spring, we also created temporary spaces to accommodate patients by setting up 5 alternative medical sites with the capacity to serve over 1,000 individuals. These sites are decommissioned now, but MEMA has the equipment ready to rapidly stand up if a facility is necessary. Secretary Sutters and I continue to talk to hospital leaders several times a week to track any trends they see and to make sure they're prepared for any future influx of cases. Their cooperation and ingenuity has made a huge difference in battling this virus. Now, before COVID hit, most people probably had never heard of personal protective equipment, so-called PPE. But overnight, global supply chains were disrupted, and states were left on their own to track down these critical materials. Massachusetts pursued every piece of equipment we could find and never stopped. To date, the Commonwealth has distributed over 36 million pieces of PPE, including almost 11 million gowns, nearly 11 million gloves, nearly 800,000 gowns, and over 24 million face masks to hospitals, first responders, long-term care communities, and others. We also worked with Massachusetts companies to start producing PPE here, everything from masks to gowns, and they're still in very active production. For the most part, hospitals are reporting that supply chains are back to normal, but that hasn't slowed down our efforts. We've continued to add millions of pieces of PPE to the state stockpile over the last several months, far more than we have ever had before. And based on the PPE we now have and shipments we expect later this fall, we have sufficient PPE to support emergency supply needs of healthcare and human service providers and first responders from now until the end of 2021. We've also increased the number of ventilators in the state stockpile. Early on, we were completely reliant on the federal stockpile for supplies, and in the spring, we were able to deploy about 675 ventilators to hospitals that needed them. Today, we have more than 1,200 ventilators in our stockpile, obviously almost double. We've scaled up the Commonwealth's COVID testing program at a rapid clip since last spring. At the end of March, we were conducting about 2,000 tests a day. By May, we were conducting about 13,000 tests a day, and now we regularly conduct over 60,000 tests a day. Over 4.8 million molecular tests have been reported to DPH to date. Over 2.4 million individuals have been tested. About 1 in 3 of our residents have gotten tested at some point over the course of the past 7 months. In the coming weeks, we'll have the capacity to administer more than 100,000 tests per day. In the early days of the pandemic, we were heavily reliant on large, mostly out-of-state labs to do most of our testing. We started with less than a dozen labs that were processing tests for Massachusetts. There are now nearly 100 labs doing this, and they're all here in Massachusetts. Our average turnaround time for testing is less than 2 days. We have over 250 testing sites in the Commonwealth, and free Stop the Spread testing sites in 18 communities to continue to increase access to testing. Criteria for testing has also been greatly expanded to allow people to get a test without question, even if they have no symptoms. I want to take a minute to underscore this point. The Commonwealth made significant progress to prevent the silent spread of COVID. Early on, the medical community was working furiously to understand the nature of this virus, including how it spread asymptomatically. It's likely this characteristic of the virus led to wildfire transmission rates. We now have several tools to tackle the silent spread of COVID. It starts with all the work people have done around infection control, face masks, distancing, hygiene, and then testing, which includes contact tracing and standard practices throughout the Commonwealth workplaces and public spaces. And no one, for the most part, shakes hands, hugs, gives high fives, or engages in close talking with anyone anymore. Previously, it was also only advisable to test for COVID if you met a specific set of criteria, including symptoms. But now that the silent spread is better understood by the medical community, our testing and tracing is equipped to meet this challenge. Colleges, universities, and long-term care facilities are constantly testing people. The ability to repeatedly test students, staff, caretakers, and our elderly in these types of settings has caught cases early and prevented contagion. Today, colleges are conducting over 25,000 tests a day, and long-term care residents and staff are being tested by the thousands. This rapid testing, contact tracing, and isolation has ensured that no college or university has had more than 200 cases, a remarkable statistic considering the size of the populations at some of the schools that have suffered small outbreaks. And last week, the positivity rate for testing at colleges and universities was 0.1%. Addressing the silent spread obviously requires a lot of resources, but the Commonwealth has put a concerted effort into keeping cases down, and that process will continue. Like other states and countries, Massachusetts saw how COVID tragically impacted our older population, particularly our seniors being cared for in nursing homes. Our state has hundreds of long-term care facilities, and many were impacted early. We took immediate action to try to keep COVID out of these facilities by requiring a range of infection control measures, even prohibiting family visits for months at a time. I know this was incredibly painful for many people because it happened to me. I didn't see my dad for over 100 days. In April, the Command Center launched the first in the nation mobile testing program with the National Guard to provide testing to nursing home staff and residents, and provided more than 57,000 tests at almost 500 facilities throughout that period. In the spring, we created an unprecedented accountability and supports package for nursing homes that provided significant funding dependent on the performance and clinical infection control audits. Clinical staff performed over 1,000 audits at these facilities during May and June. Throughout the spring and summer, the Commonwealth committed over $260 million in additional funding to support nursing home residents and staff, which is in addition to at least $180 million in federal funding. Our administration has provided 2.8 million pieces of PPE to nursing homes since March, which is more than we have provided to any other particular healthcare group. In September, we also announced a second round of reforms for long-term care facilities to make sure their residents and staff have the supports to stay safe, including new requirements associated with the flu vaccine. Secretary Sutters will talk more in detail about this in a minute. Now, last spring, closing schools and shifting to remote learning for all schools was an enormously difficult decision. But it was necessary at the time to protect students and faculty from the virus when cases were dramatically rising and guidelines for making schools safe did not exist. It's a lot to ask of parents to work from home while helping young children navigate a whole new way of learning. The creativity and resourcefulness of teachers and parents kept learning alive for kids, but we do know that for a lot of students, the spring's learning environment was less than ideal. Secretary Pizer and Commissioner Riley worked with public health experts and Massachusetts pediatricians to develop plans to get kids safely back to school. And in June, the Department of Elementary and Secondary Education published hundreds of pages of guidance for our schools to get kids back for in-person learning where the public health data permitted it. And as I said previously, this guidance has been endorsed by the Massachusetts chapter of the American Academy of Pediatrics. And based on today's data, in a majority of communities, where there's little or no COVID, it's safe to return for some in-person learning. We've also allocated over $1 billion in funding to local communities to support schools for everything from PPE to school supplies for various learning modules. And many schools are reporting great success with in-person and hybrid models. We were joined here a few weeks ago by the Quincy superintendent and assistant superintendent to hear about their success over the summer with in-person learning for special education students. Having kids back in the classroom is what's best for their education, development, and safety, and we'll continue to work with schools and communities to support safe learning models, including pods and after-school programs. As I mentioned briefly before, we learned a lot about COVID since last spring. And early on, we put in place a wide range of orders and guidance to keep people safe. In May, we started requiring folks to wear face coverings if they couldn't socially distance. And we've launched several public messaging campaigns to remind people to socially distance, practice good hygiene, and stay home if they're sick. We issued strict travel guidance for people to quarantine for 14 days or get a test upon arrival. Hundreds of thousands of travelers have filled out the mass travel form before they came here. Working with the Reopening Advisory Board, we issued guidance for every sector of the economy to open business and resume activities while fighting the virus. And we executed a gradual strategic approach to reopening nearly all sectors of our economy starting in late May. Now, almost 6 months later, our economy continues to run. Hundreds of thousands of people have gone back to work with a constant respect for the threat of the virus. From gathering limits to industry-specific guidance, we now have proven protocols in place that make it possible for people to be working. It's a far cry from the early days when every nation and every state had more or less two choices: open or close. These rules only work because of individuals' choices and how residents have changed their daily routines to adjust to the pandemic. Today, it's routine to grab your mask on the way out the door or to use hand sanitizer immediately after being in a public space like a grocery store. That said, there's no question this has been tough on everyone. Not seeing family members, grandparents in person, or canceling or dramatically altering special ceremonies like weddings or graduation parties is rough stuff. Many people have lost loved ones to this virus and maybe never had a chance to say goodbye. But we have today exponentially more knowledge and more tools available to fight COVID-19 than we did early on. And that knowledge makes it possible for us to identify cases and close contacts, help people quarantine and isolate, and work with our healthcare providers to make sure that they have the resources and the gear that they need to take care of the people who do get sick. It gives us the data and the infrastructure that we need to work with our senior and long-term care providers to make sure our nursing homes are safe and that their staffs and residents are safe as well. It gives us daily updates on our colleges and universities, as well as constant updates on our schools and childcare providers. It also gives our employer community the information and the tools that they need to keep their employers and their employees and their customers safe. There's no question that there will be more cases this fall. That prediction was made last spring by researchers and public health experts. We needed to be prepared to identify those cases early, keep our health system strong, and protect the most vulnerable among us from the uptick. We've done the work. We're prepared to respond to this virus like never before. But our preparations are of little use without the people of Massachusetts continuing to do their part. What we need from you is continued vigilance as we head into the 9th month of fighting this virus. Face coverings, distance, and hygiene are all part of the plan, and in formal work and public settings, you have been delivering every single day. But we also need your vigilance and your focus in smaller, less formal settings, especially as we all move from our backyards to our living rooms and our family rooms. Household spread, intergenerational spread. Expect to hear these terms a lot this fall. We all have a role to play here, and it doesn't end when we come home for work or the supermarket. If you've been out of state or around a bunch of people without masks or distancing, you need to socially distance and wear a mask around your family, and you should get tested. That's why we have so many sites. Use them. Stay vigilant and respect the virus. I know that we'll continue to make it through this together because the people of this Commonwealth are resilient and disciplined. And we've all done a lot of work to prepare for the fall. And with that, I will turn over to Lieutenant Governor.
Good afternoon, and thank you, Governor. As Governor Baker said, these last 7 months have been unprecedented. In April, Governor Baker tasked me and Secretary Keneally with leading a reopening advisory board charged with developing Massachusetts' plan for reopening our economy, together with individuals who comprise this board and worked really hard as volunteers with us on this effort. We spent hours working with public health experts and the employer community to introduce a gradual, phased-in reopening plan that would follow our public health data. I wish to thank the business community for embracing the industry protocols and your ongoing compliance to make your workplaces safer for your employees and for the people you do business with or serve. Thank you so very much. But since May, we have been gradually reopening our economy, and we've been doing so with success. We know there are still some sectors and communities that are struggling. It's really hard for them, and we know that. But we will keep working together as strong partners to support our Massachusetts economy. Since this pandemic began, we've worked to support every industry in every corner of our Commonwealth. Early on, we made $20 million in emergency capital available for Massachusetts-based small businesses and have implemented tax relief measures. Most recently, we launched the My Local MA campaign to drive people to shop, dine, visit local, explore other places in the Commonwealth that maybe you haven't been to, and really enjoy the best of Massachusetts, and at the same time support small businesses and restaurants and places that make up the character and fabric of our downtowns and main streets throughout our cities and towns. We've also focused specifically on helping residents and communities that have been hit hardest by COVID-19, like the 18,000 Massachusetts residents experiencing homelessness. In April, in partnership with homeless shelters and our municipalities, we outlined a comprehensive strategy to address homelessness during this pandemic. This included establishing 5 isolation and recovery sites for COVID-19 positive homeless individuals, and working with cities and towns across our state. Quarantine sites were also stood up to provide a safe place for homeless individuals who were exposed to COVID-19, with an expedited process for homeless shelters and municipalities to request equipment and supplies. An expedited process for PPE distribution to shelters was also put in place for gear and cleaning supplies throughout this process. We continued to reiterate our administration's message for survivors of domestic violence and sexual assault throughout the Commonwealth, and our message has consistently been and will continue to be that you are not alone, that you can get help, that there are resources available. Please follow where these phone numbers and these access points will take you. We care about you, and we're watching out for you. DHCD and DPH instituted practices outlined by the CDC to mitigate COVID-19 outbreaks within congregate shelters to support families in emergency assistance and domestic violence shelters. In addition to the homeless population and survivors, COVID-19 has had a statewide impact on communities and residents who have experienced food insecurity and who have also been disproportionately impacted. As a result, we made $56 million in funding available to a wide array of programs and initiatives in order to help ensure individuals and families have access to affordable, nutritious food, consistent with findings of the Food Security Task Force. This is a group of amazing people, our legislators and our community providers and members of our agencies really working together to help solve this issue. $36 million was made available through the COVID-19 Food Security Infrastructure Grant Program for increasing capacity for food direct delivery to food banks and food pantries and local food distribution partners, and coming up with innovative solutions for people receiving SNAP and WIC benefits efficiently and quickly, and developing a food system business, locally sourcing this food to get to the person who needs it the most through the food distribution channels that exist. It's a really incredible effort and something that we can learn from and continue the best practices going forward. We increased the Healthy Incentives Program by $5 million, provided $12 million for the provision of 25,000 family food boxes per week through a regional food supply system, and $3 million in immediate funding to food banks. And many of you traveled to places for us to showcase what this looked like, and thank you for coming along that ride with us. There is a housing crisis here, as we all know, and which has only been exacerbated by this pandemic. In June, we created a $20 million emergency rental and mortgage assistance program, which was also funded in part through the federal CDBG allocation. It builds upon the RAFT program, which received a $5 million infusion at the beginning of the pandemic in March. And yesterday, in partnership with the trial court and our legislative colleagues and various other stakeholders, we announced a $171 million eviction diversion initiative to support tenants and landlords during the financial challenges caused by this pandemic. Our goal is to provide new options for tenants to stay in their homes and to support the expenses of landlords by making investments to new and existing programs like the RAFT program, like Home Base, and like other proven programs. Putting dollars into the hands of tenants and landlords keep these properties in place and keeps tenants, people, individuals, and families in their homes. That's very important, always, but especially during this uncertain time. This Commonwealth was hit hard early on, but by working together and remaining vigilant, as the governor has often and continues to remind us of, we've been able to tackle this disease head on. But we all know we are where we are because everybody needs to do their part. We all have a role to play, and I'm confident that we will continue to work together to fight this pandemic, to help recover, and to get through these upcoming months. I thank you all. I'm personally very grateful to work with all of you, and I'd now like to turn it over to Secretary Sudders.
Governor Baker, Lieutenant Governor, Secretary Pizer, and Secretary Keneally. Good afternoon, everyone. Since the very beginning, we have been working constantly to stop the spread by simultaneously strengthening our response capability, capacity, and remaining vigilant. This includes diagnostic and surveillance testing, replenishing and building up our emergency stockpile, performing extensive contact tracing, planning hospital readiness, strengthening protections at long-term care facilities for staff and residents, and building our robust data analytics and public reporting systems. Let me share with you details on the COVID response network we've built. Our testing capacity is strong, as you heard the governor say, we continue to be a top testing state per capita, either first or second in the country. Even as we cannot test our way out of this pandemic, however, testing identifies individuals with symptomatic and asymptomatic COVID. It allows us to act quickly and stop the spread, and it provides critical data that we did not have in the spring. Our Stop the Spread initiative is a key part of this success and a critical driver in the access and increased testing data we're providing to persistently high-risk communities. We are regularly testing about 60,000 individuals a day compared to about 13,000 in May. As a result, we are announcing today that the statewide Stop the Spread initiative will be extended through December, a key measure to help stop the silent spread of COVID. In addition to Stop the Spread, we can and have deployed rapid response testing from municipalities to schools to hospitals as necessary. The state's response also had to include and incorporate our colleges and universities' needs. On-campus testing was instituted at approximately 75 universities starting mid-August, and about 1.3 million tests have been performed, many utilizing the capacity that was built at the Broad Institute in Massachusetts. This capability is a significant advantage compared to early in the pandemic. It protects students, faculty, and the communities around our college campuses. As the governor and lieutenant governor have said, we will be living with COVID for many more months. This level of robust testing with timely turnaround, less than 2 days on average, 1.8 to be precise, is one piece, but not the only piece of a strong foundation to identify cases, stop the spread, and inform our policies and practices. In a matter of weeks last April, we established the Contact Tracing Collaborative. Today, the network includes just a workforce of just under 2,000 who maintain regular connection with and support individuals who are isolated in quarantine. To date, more than 100,000 people have been contacted. Every day, we identify and trace a COVID case or close contact. We are helping to stop the spread. This team is performing industry-leading work and a function for us all that is helping to save lives. Recently, we have added a group of epidemiologists to investigate cases to identify the source of transmission and pick up on potential clusters before they spread. As you heard the governor say, hospital readiness and healthcare capacity are essential in meeting the needs of critically ill residents. Early on, and working very closely with the Mass Hospital Association, we enacted strict policies to ensure sufficient inpatient capacity. Reopening required days of PPE on hand, ready access to a supply chain, and reinstating ICU nurse staffing ratios. These expectations remain in place as a protective measure should Massachusetts experience another surge. We currently have capacity, as you heard, for over 1,900 ICU beds, with the ability to increase capacity by another 400 to 500 by converting medical and surgical beds and other space in hospitals if necessary. We can flex and quickly reopen alternate medical sites and expand isolation recovery sites. 3 vendors are on standby with MEMA to expedite the build-out of field hospitals if necessary. The field medical station equipment that was used at the DCU Center in Worcester is now property of the Commonwealth, and all of this equipment is inventoried, staged, and ready for rapid deployment. Additionally, we added 30 specialty beds at 2 long-term care acute facilities, expanding the number of appropriate hospital discharge facilities for individuals in need of nursing home level of care, but who have specialized needs due to ventilators or trachs. Turning towards long-term care, we have responded to the needs and significantly strengthened long-term care facilities' ability to respond appropriately to the pandemic. This includes adding dedicated isolation spaces, providing millions of PPE, 2.8 million, strengthening infection control practices, developing a surveillance testing program, and supplementing the workforce when critical shortages arise, and paving the way for long-term sustainable reforms. In the spring, we established more than 6,000 dedicated beds for COVID residents requiring nursing home level of care, We created this capacity by standing up 7 fully dedicated facilities and supporting over 170 facilities in creating isolation spaces within a wing or unit. To protect residents and staff, we launched our surveillance testing program at state expense on June 30th, ahead of federal guidance. From July 1st through October 8th, we've conducted more than 280,000 tests for staff and residents in long-term care facilities as part of our ongoing and regular surveillance program. On top of these forward-looking policies, we have further strengthened nursing homes with an injection of funding and resources with an eye towards sustainable, quality reforms. To date, the Commonwealth has committed more than $400 million in new funding, in addition, plus the $180 million in federal dollars to strengthen nursing homes with regard to staffing, infection control procedures, PPE, all with a focus on quality. The state maintains the clinical rapid response teams that we set up last spring for facilities experiencing acute staffing shortages. At one point last spring, more than 20 clinical teams were deployed daily to provide safe staffing in nursing facilities. This safety net is a critical resource to not only protect our older adults, but also to help limit the spread. Initially, this service was provided solely by the National Guard and later augmented with contracted staff. The latest set of reforms build upon the legislatively created Nursing Facility Task Force, all with a focus on quality, staffing, and infection control. Our testing, resource monitoring, and contact tracing contribute to the Commonwealth's data and public reporting, some of the most robust, transparent, and detailed compared to other states. We've added municipal-level data reporting and monitoring, which has been critical to deploying resources to stop the spread. It has included inspections of more than 5,000 businesses by ABCC and DPL to ensure compliance with masking up, social distancing, gathering sizes, and the state's specific guidelines. Our response to COVID has to be layered. We cannot simply test our way out of COVID. We need a safe, effective, and available vaccine or treatment. But our preparedness reflects. As we look forward and as we look ahead to the fall and winter months, our state is in a much stronger position than we were in February and March to face a resurgence. We plan for both the flu season and the pandemic together. COVID will be with us until we have safe and effective therapeutics. Remain vigilant. Secretary Pizer.
Thank you, Secretary Sutters, and good afternoon. Back in March, when we were forced to shut down child care centers, schools, and colleges, we had hoped it wouldn't be for more than just a few weeks. But of course, it turned out to be a much longer interruption than any of us had wanted. Now, standing here 7 or 8 months later, as we reopen our education system, I want to express my appreciation for all the creativity, hard work, and persistence that educators, administrators, staff, and importantly, parents have shown across all 3 sectors. We have all been asked to do a lot during this pandemic, but all of you deserve our deepest gratitude. In the first few days of the pandemic, we closed childcare programs across the Commonwealth, but immediately set up emergency programs to care for children of first responders, medical personnel, and other essential workers. During the height of the COVID-19 crisis, we had more than 500 emergency child care centers caring for over 3,000 children a day. Now that the surge is over, we are bringing back thousands of providers who had to close their doors. Today, there are about 5,500 programs up and running, representing about 70% of pre-COVID capacity, with available slots in most communities. Notwithstanding the tens of thousands of children now attending childcare programs, the number of COVID cases remains low. This summer, a number of public schools began reopening classrooms to help their most vulnerable students regain some of the educational progress that was lost during the spring shutdown. Several thousand students with disabilities and other special needs returned for in-person instruction safely, and only a handful of COVID cases were reported. After extensive consultation with infectious disease physicians, and as the governor mentioned, the American Academy of Pediatrics, the Department of Elementary and Secondary Education provided districts with detailed guidance on how to develop plans for safely delivering in-person instruction this fall, while authorizing extra time for planning, reconfiguring facilities, and training staff. At the same time, the Department of Public Health developed town-by-town metrics to help guide districts on whether to be fully in-person, hybrid, or remote, based on 4 weeks of community-wide case data. The large majority of municipalities have relatively low levels of COVID transmission, and most schools have reopened, with students and teachers back in school either fully or in hybrid models. Some schools remain fully remote, however, and we are mobilizing resources to enable as many children as possible to get back into their classrooms as soon as possible. To help districts bring their children back to school, the governor allocated nearly $1 billion to municipalities and school districts through formula distributions of COVID relief funds and targeted grants to address acute issues, such as providing students with access to computers and connectivity. And in collaboration with legislative leaders, the administration is committed to increasing Chapter 70 school aid in FY21, adjusting for inflation and enrollment, to ensure stable funding even in this very challenging economic and fiscal climate. Taken together, these state and federal resources add up to more than was called for under the Student Opportunity Act. The Department of Public Health has also made available rapid response mobile testing for any school that experiences a COVID cluster, which has thankfully not yet been necessary. And to help working families whose children are not able to get back to their classrooms full-time, the governor signed an executive order that allows childcare and after-school programs to open during school hours while children are participating in remote learning. Although we are just now gathering data on overall enrollment and in-person attendance, it's safe to say that hundreds of thousands of students are back in their classrooms for at least a couple of days a week. And so far, the number of COVID cases statewide is low, with most districts reporting no cases at all, and no district reporting the spread of the virus within their schools. Finally, on the Commonwealth's college campuses, our experience this fall has been much better than has been the case in most other states. According to the New York Times database, Massachusetts has one of the lowest number of COVID cases on its college campuses relative to our total number of college students. In May, the Lieutenant Governor and Secretary Keneally convened a higher ed working group of public and private institutions, which helped to develop a planning framework for bringing students and staff safely back onto campuses. The working group also formed a committee to develop even more specific recommendations for COVID testing standards and protocols, most of which is now being implemented across the state in partnership with the Broad Institute. Many colleges are also working with the State Community Tracing Collaborative, a partnership between DPH and Partners in Health, to conduct timely and comprehensive contact tracing whenever a positive COVID case is identified within a college community. Just a couple of weeks ago, the governor allocated $15 million to 47 public and private colleges serving the most low-income students to help them offset unbudgeted costs related to COVID. And through a recent debt refinancing for dormitories by the Massachusetts State College Building Authority, we have saved our state universities over $50 million, which they can use to help deal with financial challenges resulting from the coronavirus. The bottom line is that across all three education sectors, early education, K-12, and higher ed, Massachusetts is successfully implementing a deliberate reopening that is expanding learning opportunities while maintaining essential health and safety standards. In closing, I want to again thank everyone who has worked so hard to redesign their programs and operating systems in response to this unprecedented and unexpected pandemic. Through your efforts, you are enabling your students to safely continue their education while protecting the well-being of your staff and your communities. I'd now like to turn it over to Secretary of Housing and Economic Development, Mike Keneally.
Good afternoon, everybody. I'd like to provide an overview of where we are in reopening and to recap how far we've come, thanks to the efforts of so many. On May 18th, we released our reopening plan to allow businesses, services, and activities to resume in phases when public health metrics met certain criteria. The reopening plan created a thoughtful, careful approach based on data, not dates. with protections and protocols that sought to balance the economic impact of reopening industries, the public health risks posed by reopening, and the overall goal of limiting the spread of the virus. During the development of the plan, we also released mandatory safety standards that apply to all industries and activities, and that require protections for workers, customers, and vendors. We began to publish and continue to publish sector-specific guidance, which address the unique needs of particular industries to further minimize virus transmission, while allowing for the resumption of operations. Do we have rules in place that may be more stringent than those in other states? We do. But at the beginning of the pandemic, Massachusetts was among the hardest hit states. Accordingly, it was in those early days that we asked so much from everyone to limit travel, to work from home, or to outright close the doors to their businesses. But thanks to everyone's buy-in to the standards that keep people safe, our numbers of new cases remain low, the Massachusetts economy is open, commerce is taking place, and we're keeping the spread of the virus to a minimum. Without question, local businesses underpin the character of our downtowns and main streets. According to the U.S. Small Business Administration, in 2019, small businesses in Massachusetts employed 1.5 million workers, over 40% of the Commonwealth's total workforce. In light of that, we needed a plan that would allow for progress, protect gains, and avoid a situation where we'd have to go back to a prior phase of reopening. And we've also been able to invest funds to transform outdoor spaces in our communities into places where people can safely dine and shop. Understanding that a move to phase 4 requires a medical breakthrough, the progress we've made so far has allowed us to shift to a more local and targeted approach, where individual communities designated as lower risk have now advanced to step 2 of phase 3. I want to thank everyone for their willingness to work together, to adhere to standards and best practices, and otherwise to make major adjustments to daily life. Combined, this is what has allowed us to make the progress we've made over the last 30 weeks. Eradicating COVID-19 does rest on a medical breakthrough. Until then, we need to continue doing all we can to keep up the fight against the virus, to continue making progress on reopening our economy, and to protect the public's health.
Questions?
Governor, you had said that that there was no question that experts had predicted an increase in cases in the fall. I wonder, are you starting to see the beginnings of a second surge?
Well, we certainly have seen over the course of the past month or so an increase in daily case counts, but that's been true pretty much everywhere people are testing and counting, with the possible exception of some parts in Asia. This is something that I think we planned for and anticipated, and a big part of what we've been up to over the course of the summer is to make sure that we had a robust testing infrastructure in place, solid rules for our employer community, an approach to the 3 levels of education that Secretary Pizer mentioned, enough ammo in our contact tracing program that we'd be able to do the outreach and the isolation, the quarantine and support work that would be necessary, and a commitment to make sure that we continue to inform communities every single week, every day, and then again every week with the public reports about how their particular communities were doing. But this is not something that I don't think was unanticipated.
So a surge, would you call it the beginnings of a second surge?
People use different words to describe this stuff. I don't consider where we are to be anywhere near that. I consider it to be what we have as a rise in cases that a lot of people predicted was going to happen months ago. And we've been preparing for that and have done a lot of work to put ourselves in a position in Massachusetts where we can identify cases early and do the work associated with stopping the spread, and especially making sure that we have a solid infrastructure of infectious disease control, surveillance and testing and tracing in place, especially around long-term care.
And
As
then
far
none
as
of that
the
is
virus, Governor, are you prepared to reopen field hospitals if it comes to that, if we get that bad?
Well, remember, as I said in my remarks, our peak hospital inpatient total back in the spring was 4,000 COVID patients. We now have about 300 that are sure COVID in our hospitals, which is way, 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 way less. And we did set up a number of field hospitals because we didn't know how many beds to expect, how many cases to expect last spring. And you may recall that we used the Boston one some, and we used the Worcester one some. So I mean, my view at this point is I think we have plenty of hospital capacity. But it's there and it's available if it were to be needed.
Governor, why such an extensive recap of all the efforts today? Why is we hearing about all? I mean, we've been obviously covering it day to day, week to week. But why is such an extensive recap today?
I think part of the idea today was to just make clear to people that a lot's happened over the past 7 months, 8 months. We are in a very different position with respect to our ability to test and trace and isolate and quarantine, and we have far better data that we can make available to our communities and to our healthcare system than we could last spring. And that we've done a lot of work, in particular with the healthcare community and the long-term care community, to sort of make them far more robust with respect to their ability to deal with whatever might come. I think it's important to remember that we are not where we were in March.
Governor, given that this surge or uptick, I guess I'll call it, is predicted in the fall, some experts in the healthcare community are saying soften the blow by ending indoor dining and other indoor activities. Is that something you would consider? And I guess how bad does it have to get, if we're not where we were in March, how bad does it have to get for you to shut some of that stuff down?
Well, we keep track of those metrics that are posted on our website every single day, okay? And we continue to follow a lot of the information that we get from the contact tracing folks with regard to not just outbreaks, but also just contagion generally. And I think it's really important to point out once again, and we can't say this enough, and Dr. Birx, by the way, said the same thing when she was here last week. The biggest single issue that's driving case growth is familiar people being familiar with each other. And she talked in particular when she met with us on something that we've seen in our own data, which is a really significant increase in positive cases amongst people in their 20s and 30s, which, by the way, is also translated, not to the same extent it does with older folks, into an increase in hospitalizations for people in their 20s and 30s. And I think one of the things that's critically important in this is to recognize and understand, especially with respect to young people, I don't see a lot of 20s and 30s in this room, that community, more than almost any other at this point, is driving the single biggest increases in cases. Now, the good news is most of them, the vast majority of them, don't get as sick as somebody over the age of 60 would. But many do, and they do have the potential, as I said in my remarks several times, to pass it on to other people in their family or in their network who are older and for whom getting the virus could be a very terrible thing. And I think that in many ways is one of the most important elements to where we are now versus where we were last spring. We now have really good data that we collect every single day from our testing efforts around which populations where are driving the increase in new cases.
So the calls to end indoor dining from these doctors, you say?
There's no evidence that that's what's driving our cases. I mean, I'm not going to stop doing things just because somebody doesn't like them. Somebody needs to actually demonstrate in our data that something is actually driving cases. And right now, the thing that's driving cases are young people, not even necessarily college kids. We're talking like kids who are out of college, who are spending a lot of time with each other in close quarters, apartments, rooftops, places like that. They're not social distancing, and they're passing the virus around.
Why not release that granular data then?
We do. We release it every week.
About how the virus is spreading in terms of parties or indoor dining.
Well, we do release data on tracing quite a bit.
But
Governor, could you elaborate on foreclosures? What part of yesterday's announcement is supposed to help or work with homeowners who are at risk of foreclosures? And also, why did you choose that in lieu of extending the moratorium? Was it the judges, the federal judges' comments or something else that played a role there?
Look, there's a lot of elements to it. Certainly we pay attention to what's going on in the courts on this stuff, but the bigger issue was the longer the moratorium stayed in place, the deeper the hole would become that everybody would have to find a way out of. And the uncertainty and the difficulty of continuing to just let that problem fester, from our point of view, was the wrong move at this time. I mean, when we put this moratorium in place with the legislature last spring, there were somewhere around 500,000 more people out of work than we have out of work today. In addition to that, we do have resources that are available to help create stability for homeowners, for renters, and for landlords, and especially for smaller landlords, and especially for tenants who are both feeling incredibly uncertain about what's going to happen now. We felt it was important to work with the courts, with the housing community, with a lot of the folks in the legal service community and the mediation community to put together a program that could create some degree of stability and certainty for a whole lot of people who basically have none of either if we let the thing continue.
And I'm sorry, foreclosures, could you guys speak to that? Can you elaborate or maybe point me to and remind me what some of the resources there are?
Do you want to speak to foreclosures, Mike?
So there are forbearance rights built into every mortgage, right, both at the state and federal level. And it was our thought that we really needed to aid renters directly with dollars, and folks that had issues with mortgages would have their forbearance rights in place.
Governor, in that plan, you mentioned that you're going to be bringing back some judges to deal with the backlog.
Say again?
Sorry. In that plan released yesterday, you mentioned you're going to be bringing back some judges to help with the backlog in evictions cases, and I believe in some of the other courts as well. Can you let us know how many judges you're talking about, what they're going to be getting paid, and how long you anticipate needing them?
You know, that piece of the drill is actually on the trial court. I would suggest you reach out to Justice Carey for guidance on that. What we were really doing, our primary focus was working with them to create a front end that would keep people from ever getting to court in the first place, and sort of working our way upstream to create a process that would make it possible for people to actually get this stuff resolved using mediation and representation and resources. And by the way, the legislature made some key changes to the RAF program over the summer that made some of this possible, so that fewer cases end up. I mean, the last thing you want if you're trying to deal with this is for people to end up in court around an eviction hearing. The goal here should be to try to solve this stuff before it gets there. But the trial court had talked about the fact that they might need some additional people, and we said basically that's something we'll work with you on making sure it gets funded, but I don't have insight into the numbers.
There was a perception from some of the housing advocates that the $171 million, while a good first step, is not going to be enough to deal with some of the need. And then seeing that, okay, they're bringing on additional judges to deal with this extreme, amount of anticipated cases, it just kind of doesn't really add up.
Well, I think the courts definitely want to be prepared, just like we do, which is why we've spent 6 weeks at this point, sort of working through what a process and a product could look like to help people deal with this. But nobody really knows at this point what the universe looks like. And what people had said to us is, if we had to guess, we'd guess somewhere between here and here. And the number that we came up with was pretty consistent with where people were basically creating sort of estimates with regard to this. If it turns out that it's more than we need, that's great. If it turns out that it's less than we need, we'll figure it out.
Governor, there are certain towns that are complaining about the way you do the risk map, the code red towns, that may have a contained problem within a jail where inmates are not getting out to the general population. Middleton's a good example. North Andover has said it's all about Merrimack College. Is there any way you can change the so that those towns could be in the green when there isn't a great deal of risk from a contained situation?
So the first thing I want to make clear here to everybody is we've said all along that people need to look at data over time. We publish this thing every week. It's 2 weeks worth of data, and we've basically said, since we began publishing it, that someone needs to see 3 reporting periods before they draw conclusions about a trend. Because you will have examples where, you know, there'll be a couple of families, I mean, in some of these small towns, okay, and we have a lot of those in Massachusetts, you know, 3 or 4 families who passed COVID among themselves can create enough cases to turn a town yellow, and in some cases red. Avon went from, you know, white to red because they had 5 cases based on the way the math is done there. So point number 1, this is part of our surveillance effort, and we think it's really important the communities take the data and incorporate it into their planning and their decision making. And remember, we may report it once a week, but those cases are becoming available to the local boards of health as they come in, as people test positive. So I think it's really important to make clear that we said all along, whatever decision you're making, think about this in terms of 3 reporting periods, 4 weeks worth of data. Because that will deal with the issue of, you know, we had a couple of things happen and then it went down. With respect to things like jails, long-term care facilities, you know, isolated colleges, isolated spots, I think our view is we'll put the data out there as it stands, and then we're happy to work with communities around decision-making or messaging that's associated with whatever their particular circumstance or situation might be. Everybody knows that Middleton is about the jail, just as I think most people know when there's a particular element, people know that, and it gets talked about, and that's appropriate. But for us to start, you know, for us to start saying, well, we're not going to call this one that, or this one that, or this one that, and making what we consider to be value judgments on the data, on some level, I think that would create more confusion than it would create clarity. Whereas
I talked to the town manager about it, and he says they can't go to step 2 of phase 3 because they're red, and yet they only have 1 case in town outside the jail.
in 2 weeks,
So could they go ahead and move?
well, no, in 2 weeks from now, when the outbreak is over, they'll be able to go to step 2. But I don't think it makes sense for us to change a program model for 351 cities and towns for 1 or 2 outliers. I mean, I just don't think that's the right way to do it. I want people to be, by the way, when we first started putting this stuff out, people would look at the 1 week of data and immediately start doing things. Even though we had said to people over and over again, treat this as a rolling average. You know, 3 weeks worth of reporting periods, 4 weeks worth of data. And people now seem to be doing that, and we've had a lot of communities who have, you know, bumped into yellow or bumped into red or whatever, who have basically not changed where they were or what they were doing because they understood that the particular situation that caused that to happen wasn't persistent. I mean, part of the big issue here is to recognize and understand that communities are going to bounce around. I mean, in a lot of communities in Massachusetts, 10 cases in that 2 week period can move you because they're not big places. But we think it's really important if you have 10 cases and you have 15,000 residents that you and we should be talking about that and doing something to make sure that whatever needs to be done with respect to tracing and isolation and quarantine is being done so that 10 doesn't become 20.
Would you consider some kind of like appeal process for those cities and towns that have the contained viral outbreaks, like in the jails or the college campuses? Like in North Andover, where they're having the issue at Merrimack, those restaurants are still struggling from the gas explosions. You know, is there anything that those towns can do to maybe appeal to you to allow them?
Is there anything about our order that would affect their restaurants?
They're already open
Yeah, they're already open.
The issue is going to step 2.
The next step.
Back to step 1 of phase 3.
The capacity is restricted, I think, compared to step 2 for some of the businesses. He was saying his revenue's down on his restaurant tax, local restaurant tax, lodging tax.
That might be a gathering issue. I don't think that's a restaurant issue, is it?
No.
It's not a restaurant issue.
Governor,
Back to your point about the spread being among 20 to 30-somethings, do you have concerns or advice for families who are thinking about their holiday plans coming up, where you have traditionally we have different generations getting together, sometimes from different households?
Yeah, we are probably going to have to talk about Thanksgiving at some point. I mean, yeah, I don't have what it is that we should be saying about that today, but that's certainly going to be a conversation that I think a lot of people should take seriously. It's just like the conversation we had about Halloween, where we basically said, much better for people to be outside. I know Halloween is not Thanksgiving, but there are a lot of people who are saying you should cancel Halloween, and my view was all that does is move it inside and create more close quarters and close talking and close contact than actually what Halloween traditionally has been, which is an outdoor event that involves very few close contacts, at least if it's done in a supervised way. So I think Thanksgiving is going to be the source of some interesting conversations, not just because of the family gatherings, but also because it's one of the biggest travel days historically of the year. And that creates all kinds of other issues.
I mean, do you have concerns that the season in general could turn what's an increase in cases now into a second wave potentially?
I don't like to get too far down the road on this stuff because, as we've all learned over the course of the last 8 or 9 months, things happen, things change, the facts change. But what I would say is what we said before, which is that as people move from backyards to indoors, for a lot of those familiar gatherings, people need to be really cognizant of who they're with and where they've been. And as I said in my remarks, you know, if you have a friend or a neighbor who's been traveling out of state, you're probably better off not watching the Patriots game on Sunday with them, unless they've been tested and they've tested negative. The biggest challenge here, based on not just what we've seen here, but also what Dr. Burke said to us and what others have said, is going to continue to be this informal stuff. The formal stuff, people get that they're supposed to wear a mask when they go out. And by the way, that's different than what it was in March and April. People get the fact they're supposed to wear one of these when they go out. They get the fact they're supposed to social distance. They get the fact that if they can't keep distance from people, they need to do this. They get the fact that if they go into a store, they need to wear a mask. People get all that. And they're doing it, and it's working. But the challenge is all that other time that we spend, in some cases, with people who may have been out and about with others where they weren't distancing and they weren't wearing a mask. And especially when you get into the younger communities, the 20s and the 30-somethings, they do pick this thing up. They are often asymptomatic, but they do carry it and they will transmit it. And we're all going to have to think differently about that.
So how do you get through
Any surprise?
It's a challenge, and we've been talking about how to do it. If you have really good ideas on that one, Jonathan, we'd love to hear them.
You gonna get on social media or something? I mean, they're probably not watching this right now.
You should see what my kids told me we should be doing.
Any surprises on tomorrow's map, Governor, that you can give us a sense of?
Tomorrow.
question for Secretary
Not
Sutters.
knowing tomorrow's numbers, your approach has been very much municipality by municipality, but recognizing that people typically don't operate in municipal geographic boundaries. If the state were to tick up into a statewide red category, more than 8 cases per 100,000, would you begin to think differently about your orders and do something statewide?
Well, again, that's part of the reason why we put the data out, because it varies a lot from community to community. There's still more than 250 communities in Massachusetts that are in pretty good shape, and we should not forget that. Just as we should not forget that a bunch of these communities that bounce from green to yellow because of 4 or 5 cases over the course of the previous couple of weeks. Now, we don't want those 4 or 5 to become 10 or 12 or 20, okay? But that's the whole point behind having a community-based map, because it does provide surveillance and it does provide regular information to people about what direction their community's heading in and where they're at. And that's the way we think we should play this.
Governor, can I ask you a question about health clubs? ghost towns, a lot of them, and they've spent a substantial amount of money. They've gone under in the last 30 days. If you include 16 closures of the Boston Sports Club, about 50, there's one a day closing gyms across Massachusetts. And they want to know, first of all, why you haven't visited one in the last 7 months and seen what protocols are in place to perhaps generate some interest to go back. And if you will go there to like the gym and see what's going on, to see the safety precautions that are going on. That's through these owners, this question.
I'm happy to follow up on that question. I'm not going much of anywhere these days for a lot of reasons, but I'm more than well aware of the fact that there are, and I've said this, that one of the cruelest elements of COVID is the way it impacts some businesses relative to others. You know, being in almost any enterprise at this point that involves a lot of people doing something indoors, and a lot of the gyms and the health clubs that I know about basically offered all of their classes and a lot of their fitness programs outdoors through the summer into the fall, recognizing that at some point it would get too cold to do that stuff outside. But one of the biggest issues with COVID, and it's not fair, but it is what it is a lot of people just don't want to go to certain places anymore because of the issue associated with the virus generally, which is why we've been so aggressive about promoting data on a town-by-town basis to give people guidance and information about where we have hotspots and where we don't. And this gets back to your question, Matt. If you just think about this as a statewide issue, then you would draw a broad conclusion about all of Massachusetts, and every business and every community in Massachusetts would be affected by that one way or the other. Even though in many communities, hundreds of them in Massachusetts, you're still playing at a rate that's under 4 cases per 100,000, which means in those communities, there are a whole bunch of activities that should be deemed reasonably safe. But there's a lot about this, Tom, that's not fair.
Governor, any progress on the Chapter 93 data? Or perhaps Secretary Sutters, if you could speak to that at all?
The Chapter
Any
93?
progress on-
So there are 42 reporting elements for Chapter 93 in the Department of Public Health to report on. The Department of Public Health is compliant on all measures except for 5. 3 should be in place by the end of November, and 2, we filed legislation that is currently before the legislature.
Thanks, everybody.
Thanks, folks. Thanks, Governor.